So I am going to be refuting against our opponent for the negative. See that for our significant evidence, we stated that Schedule 1 drugs are rated the most dangerous and highly addictive. Schedule 3 drugs are also prescribed by physicians. That's what we stated before. For point A, we state that the negative response regarding moving medical marijuana from Schedule 1 to Schedule 3 is that it should not be prescribed by physicians because it is harmful and useless to smoke medical marijuana because there are medications out there that can cure or treat these illnesses and diseases. That's what they are stating. According to the United Patient Group, medical cannabis is very effective. It's a very effective medicine used by patients across the globe to treat and alleviate symptoms of many serious medical conditions that do not respond to traditional interventions. Studies have proven that cannabis has therapeutic properties that cannot be replicated by any other currently prescribed medications, and it induces far fewer than much less severe side effects than many commonly prescribed pharmaceuticals and over-the-counter drugs. There are alternative ways to intake medical marijuana other than just smoking it. There's vapor, there's edible. According to Green Spoon Lester, there's very little evidence that smoking marijuana as a means of taking it represents a significant health risk. Although cannabis has been smoked widely in Western countries for more than 4 decades, there have been no reported cases of lung cancer or emphysema attributed to marijuana. I suspect that safe breathing in the city, any city with poor air quality, poses more than a threat than inhaling a daily dose, which for many ailments is a portion of a joint of marijuana. If we think about it, tobacco has many records of deaths. I don't know the exact number. Marijuana has 0 records of death. So, I mean, she can say that other drugs, yeah, they could be legalized, such as heroin or cocaine, but those are drugs that cause death. Unlike marijuana, there have been no records of death of overdosage. By substituting, for point B, by substituting other drugs for medical marijuana, the negative said that these other drugs can help and are better than marijuana alone. She stated that it was acupuncture. The evidence is overwhelming that marijuana can relieve certain types of pain, nausea, vomiting, and other symptoms caused by illnesses such as multiple sclerosis, cancer, AIDS, or by the harsh drugs sometimes used to treat them. And it can do so by remarkably safe. Indeed, marijuana is less toxic than many of the drugs that physicians prescribe every day. I mean, there's drugs that physicians prescribe to you, say if you're a cancer patient. You can abuse that just like you abuse marijuana, but like I said, marijuana has no records of like overdosage and death, such as, you look at, I don't know the specific drugs, but there are drugs out there where you can just overdose and kill your liver, kill anything. So that's my point on that. She also stated, I'm gonna go back to acupuncture. I found that the general fees for acupuncture range from around $60 to $120 per session, and that acupuncture can be scheduled as often as 5 times a week or as little as once a month. Sure, if you're going to use it once a month, that makes sense, that it's a cheaper route to go. But if you were to have to go through that 5 times a week session of acupuncture, you're spending more than you are purchasing marijuana. So according to the Cost Helper, the cost of marijuana buds can vary based on quality and the location of purchase. Typically, a gram of buds can cost $5 to $20, an eighth or 3.5 grams can cost $20 to $60, and an ounce can cost $200 to $400. Like I said, it can cost up to $120 per session. So if you were to count that 5 days a week, that's going way over just buying the $400 ounce of marijuana. Whereas if you're not going to be abusing it, you're going to use it for its actual benefit for your condition. So we say that the best alternative, marijuana is the best alternative of medication cost and health-wise. So setting aside the controversy, marijuana has been shown to have medicinal properties and can help with some types of chronic pain. There's strong evidence that marijuana has a modest effect on certain types of nerve pain, particularly pain caused by MS or HIV, says Stephen P. Cohen, and the associate professor in the Division of Pain Medicine at Johns Hopkins School of Medicine in Baltimore. Since it also relieves nausea, marijuana can help people who are suffering side effects from chemotherapy. And that's really